Another option for the lower back, while the instrument is great for helping loosen those tissues, this is providing a compression, right? We're pressing into the tissue. And a lot of the therapies that we do actually provide some compression into it, whether we're doing stuff with our hands, whether we're using an instrument. Uh, a lot of things are pressing into the tissue. But if we actually want to lift the tissue, particularly because it's tight, one of the options that we have for an alternative therapy is what we call cupping. So with that, we're actually going to use cup, right, with some suction or some vacuum therapy. So we place the cup on top of the tissue, and from here, this gun is just going to kind of suck the air out of it a little bit. So we'll do 1 pump, 2 pumps, and you see the skin rises up into the vacuum of the cup. We can leave the cup there, right? And what it's doing is, as it sits there, as it vacuums, it's drawing the tissue, drawing the tissue up in the vacuum, and it's kind of restricting the blood flow. And so you'll start to see some redness of the skin and the tissue that's actually being vacuumed. From there, besides just leaving it on the tissue, we can actually start to move it a little bit. So we have a little bit of suction, but we can actually slide it with the tissue, with the emollient that we used from our instrument, from our Hawk grip, and just moving it up and down that tissue. And it's actually providing a distraction force as opposed to a compression force, which is really nice, particularly for those tissues that just feel so tight, or that lower back that just feels so tight. It's providing that